my screen, share screen, right? You want me to?
Um, okay, I want to welcome Michele Sims from Aetna, our Aetna broker manager. I'm going to give you the chance to share your screen. Did that
Okay.
work?
Well, let's see. Oh, it does. Beautiful.
Mhm.
Okay. All right. So let's switch it over. Let me change the view. Gotta love technology. Woohoo, it's working. You guys can see?
Yes, we can.
Okay, awesome. So you guys made a great decision in, just getting more information about our Medicare world. It's a lot of excitement, of course, because you have prospects aging in constantly every day with all the baby boomers coming in and being eligible for Medicaid care. And of course, we have, a product now that also supports Medicare and Medicaid recipients. So you have, a lot of opportunity out there. And Aetna is one of the carriers that, I feel is a must have. I've worked with I was actually an independent agent at one point. I also worked for carriers. So I've worked for all three carriers that are pretty big in New Jersey, which is Horizon, United, and Aetna. So usually those you want to have as a must when you're considering being an agent because these are, at least with Aetna, I can speak for Aetna, is we are a national company. So whether it's offering, if once you get involved in this business, you want to be, licensed in the state you live in, of course, in New Jersey. But as you become involved in this business, you might even want to get licensed in other states, especially in our tri-state area as you get referrals. So we are a national organization. And a lot of our plans have that national outreach when it comes to providers. So a lot of people on Medicare, they might want to go to Florida a couple months out of the year. They might want to go, travel. They want to know that they can use their plan in any state. And that's one of our value propositions that, our plans are portable. So you can live in New Jersey. Maybe like how, my parents actually were back and forth to Florida, for the last 20 years. So it was important to them to have doctors down there as well as here. So it's going to be important to your members too. So just knowing that you have that with Aetna is important. So, and I'm sure some of those other companies do too, but I'm just here to talk about Aetna today. But so why Aetna? I'm just going to do a couple of an overview, what you can expect if you basically, do all your certifications, become an independent agent, and you have Aetna as one of those products you're going to be offering to your clients. So basically, I'll be talking about New Jersey because I am a New Jersey broker manager. So as I was saying, is you have a lot of opportunity here in the Medicare space. 50 million people nationwide eligible for Medicare. Then you have that whole other subset of folks that may be disabled or qualify also for Medicare and Medicaid. So a lot of opportunity there. One of those products that will fall under that umbrella of Medicare is Medicare Advantage. So Medicare Advantage is where the private insurance carrier like Aetna, like United, like a Horizon actually manage the plan. It has to cover everything Medicare covers, but in addition to that, we can cover additional benefits like a free gym membership at no cost. We can cover eyeglasses that Medicare doesn't cover, an eyeglass allowance. We cover all types of preventative tests that Medicare may not cover. On top of it, they get a drug plan all in one. So a lot of times when someone's just on Medicare, they have to, kind of explore their options. And Medicare Advantage is definitely one of those options, one of those types of products that is an all-in-one product that is managed by the insurance carrier like Aetna. So they would be getting like a PPO or an HMO with us if they choose to go with a Medicare Advantage. Then they also can choose an ancillary product. And anytime you hear ancillary, you're probably like, well, what does that mean? Ancillary products are products you can add on, like similar to like a life insurance plan, not to get too in the weeds, but it includes final expense. It includes a cancer, heart attack, and stroke plan, a dental only option. These are just additional products you can actually cross sell on top of any MAPD plan or any supplemental plan. So we'll teach you those products, of course. It's not something you have to know out the gate, but knowing what's available that you can offer in addition is just going to make things better for you, because you'll have a client that's very happy with multiple products, and the likelihood of that person staying with you for life is it gets stronger the more products you sell them. And of course, we're all about, making money, right? So you want to, the more products you sell someone, the more money you're going to make as well. It's more commissions. Medicare Advantage does have lifetime commissions. So that's another advantage of coming into this field, because it's the gift that keeps giving year over year. So as you get started and you're building your book, you're, selling these products, every year that member, renews their plan, you're going to be paid a residual. So that is what we call, it becomes an income if you do this long enough in the business year over year. Another reason why it's a great thing to get involved with this business. And then you have your supplemental plans. So Medicare supplements are where someone keeps their Medicare as a primary coverage, and you can offer them a secondary to their Medicare. So that's another type of product people have as an option. And that's something, of course, that Aetna has. And another advantage is Aetna is in all 21 counties of New Jersey. So there are no gaps. We're in the entire state for all our products except DSNP, which we'll talk about later. DSNP means the folks that are eligible for Medicare and Medicaid. We got involved in that this year, 2021. We will be expanding in 2022 to the entire state. So soon we will be there, but right now it's 10 counties for that particular product. We'll talk about that later. And then you have your standalone drug plans that we sell. So let's say someone says, I just want to keep Medicare, or maybe they have a supplement. They're going to need a separate drug plan to actually avoid a penalty through the government. So knowing that, you can just offer a separate PDP plan, which we call prescription drug plan, is another product you can offer to client. So basically, just a little bit about New Jersey. Anyone that becomes ready to sell, once you go through all your certifications and everything's all set, and you say, I want to, get a contract with Aetna in order to sell them. Once you become ready to sell, everyone gets assigned a broker manager, like myself. So I'm a broker manager in New Jersey. There are 2 others. So basically, if you go through the certification process, Pam is, she's basically, I manage her. So you would be rolling up under me as well. So basically, I'll be your point person in New Jersey, and I'll basically, help you with any support you need, guidance. We do trainings, we do one-on-ones. We really want to meet you where you are, at any level, and just get you where you need to be. So we'll work with you, and with, of course, partnership with Pam, because she is a seasoned rep that is really great. Kudos to Pam, if you can hear me. So
Thank
she's
you,
also
Michele.
someone, a resource for you, of course, but we work in partnership together to just maximize, what you need to do, whether it's, giving you retail opportunities or opportunities to be out in the community, to meet people at events, whether it's seniors or the Medicaid population. We do that. We develop those opportunities for our brokers because we want you to sell our plan. And if you don't even sell Aetna, we want you to be successful at any plan. So of course, if Aetna, these plans work the way, it's never a perfect fit, right? So maybe we're, the best network, but maybe the person can't afford the copay or some out of pocket that doesn't, not every plan is a perfect fit for everyone. So you might have to sell them another product because it's just the way it is after you do the analysis. And that's okay. We want to make sure, you are at the level that you're comfortable presenting Aetna. And if it doesn't work for your client, that's okay. But we want you to be successful as well. So we're going to, try to get as many opportunities as you can as a new agent. So our local sales team does year-round product trainings. We do all types of trainings. We have, tools, technology tools, whether it's our enrollment application, how to, electronically enroll someone, how to do a virtual meeting, how to compete with the virtual world nowadays, because now, with COVID, people have to learn how to do business a little differently. It's not as much as a face-to-face. Now it might be over Zoom or a FaceTime call or a phone call that you're doing initially. So we have transformed our business to just try to teach our brokers how to do business a little differently. You guys are new, so you're not maybe as used to doing, a lot of the brokers that have been doing this for years and years and years, it may be harder for them to kind of, get on a Zoom call or learn technology. So you guys are already ahead of the game because you're already there with technology, which I see all of you right now are on Zoom. So some people, believe it or not, don't even know how to use Zoom. So, you'd be surprised. So we're going to teach you how to use those tools, our tools, and of course, anything, any resources available to you. We try to help you along the way, of course. We have an HMO and PPO in every single county. So we have no shortage of plans. We have almost too many plans, but I can help you identify which plans are the, hot sellers of that county. So any questions you ever have about, what to present to a client, like, I don't know what to do for a sales presentation. We have guides, we have sales presentation videos. We have all types of things that are going to help you. We have new people coming on every day, and they're not necessarily in the insurance industry. Some people are, I have a new broker that used to be a radio DJ, so there's all different types of people getting involved in this business. So we just, try to see where you're at and then meet you where you're at and then get you to, the next level. And that's what everyone wants to do. You want to always, build your book of business and then, continue to build your book and retain those clients that are giving you that every year income. I mean, that's really your goal. So some of those year-round opportunities that we give our brokers, just pictures on the left, is we have a year-round retail program. Let me just move the picture thing over here. I wonder if I can collapse this. I think I can. Okay, good. So we have a year-round retail program. Now, CVS owns Aetna now. So CVS is available to us all year long. So just like that picture on the left-hand side, yeah, there would be a setup at a CVS with a table, and you would be behind that table greeting people like, hi, I'm here, answer any questions about Medicare. You're basically the product, and really the goal there is for you to meet new people and get leads. So, it might not be a sale, but it might be some other type of sale. It's really the goal is to get out there and meet people. Now with COVID, our retail program somewhat pared down, but people are out there doing it with a mask safely, of course. Most of our brokers spend 2 or 3 hours at one retail location. You can do as many as you want. You can do as little as you want. There's no criteria, you have to do 25 hours a week or something like that. No, we let you do what you want as far as the time frame, what works around your schedule. And we provide all the material you need. So whether it's a table like this with a tablecloth and then, some signage, or, we have little kiosks that are smaller, that you can just like a pop-up stand where you can, put flyers and then sit or stand next to it and greet people. It's really just about, trying to meet new people and offer them that assistance with Medicare and hopefully book an appointment or build your book of business for annual enrollment period. because, a lot of our agents love doing retail, especially around open enrollment time, because, they do encounter people and get sales from it. So it's a good way for new agents to kind of get started in your local community. You could be a local resource to that store. CVS is one of our retailers, but we're also in the process of getting about 40 Dollar Generals and dollar stores, which is a little different than we are normally used to. But we're getting a great reception for some of the dollar stores we've been doing. And we not only give away our Aetna giveaways, but we also buy things from the dollar store and give those away too. So we have a couple agents trying it out. So we are going to get more of those. And when we have those, we'll also offer that to our brokers. And we'll train you to do these events. They're not really difficult. You're just really there to build your book, smile, be friendly, ask. And if you don't know every answer, it's okay. You can, be a reason to get back to them and check with me or Pam on the answer. So, don't be intimidated by it. But, it's a great opportunity for our brokers all year round. We also have, like I said, our dual plan, our dual Medicare and Medicaid plan also has a lot of opportunity because these folks that are enrolled in a dual plan or eligible for Medicare and Medicaid or extra help, they have extra enrollment periods throughout the year. So these folks qualify for special enrollments 3 times out of the year. So every quarter, and then last quarter is annual enrollment period. So they really can change a little bit more often than the average person. So there is more opportunity. So we have a lot of projects out there. We call them grassroots opportunities with our brokers that we're doing locally in the community. And we need brokers for those. So now that things are starting to open up more, we have more opportunity coming. Like we've been doing a laundromat project here on the left-hand side. That's actually me right here. We did in Camden. This is a huge laundromat that is, we do 2 or 3 days out of the week, a couple times a week. We invite our brokers in sometimes our field service rep is there, but basically it works just like a retail event where we set up a table, we give out laundry cards to our senior, called a senior appreciation day. We give them a free wash and dry, and we give out soap, detergent, dryer sheets. I mean, it's a big event. People love it. I mean, we've been doing multiple laundromats around around the state, mainly northern New Jersey and Camden. We're going to start doing some in Ocean County as well. But, these are things that have been taking off. It's being done all around the country as well. So it's a big project and it's really been getting rave reviews. I mean, the community loves it. We've been getting a lot of leads from it. Sorry guys, my phone is a duck. You're not hearing a duck. So basically, it's a great initiative we've been rolling out, and as more and more things open up, I mean, obviously we wear masks at any event. Everything is safe, so, and as things open up a little bit more, there'll be a lot more opportunity. Like this Camden event, we just started doing this laundromat in Camden, and 2 of our brokers already got, 2 sales each from this event, which is good. I mean, we just started there, so it's a great opportunity. We also do food banks. Oops, sorry guys. We also do some food banks. Same thing. We do like a tabling, and where there is a resource to ask questions while they're giving away food. Usually we do a lot of giveaways. So those always are available as well. Due to COVID, a lot of it has been like drive-throughs. So as things, begin to open up, or even summertime outdoor events, we'll be doing more and more of those. So once you get certified, if that's something you're interested in, you talk to me, talk to Pam, and we can get you started on some events, because that's how new agents really get out there, is trying to make your presence known and meet people, because that's how you're going to meet people out in the community, especially seniors. So just quick recap is, we're looking, Aetna in general, we partner with our brokers. We would partner with your team, to just maximize any opportunities or the selling potential you have, and any ongoing support, any level. Like I said, we meet our agents where they're at. Sometimes we have agents that have been in the business for, 40 years. And then I have like agents, like I said, that used to be, a radio DJ and now is in the insurance business. That's okay, because people are smart. They know how much money they can make in this business. So sometimes they do it as, they retire from one job and start this on their own. So a lot of different people involved in this business. Some people do it on a part-time basis, might have a full-time job. So we meet our brokers wherever, whatever level they're at. Like I mentioned, we have those year-round opportunities. We like hungry agents. We like agents that like to work with us. So you let let me know that you want to work with us and do these opportunities. We're definitely going to give you that opportunity to do that. We have sales contests, really around AEP. Sometimes we do these incentives and programs. I would love to do that. If that, had an opportunity, I would offer that to our brokers, of course, when that becomes available. We do have a value-based enrollment bonus program for any new clients you sign up through our electronic enrollment tool. The tool we use is called Ascend. So you would download that application to whatever device you use to enroll your clients. And after you enroll the client, there is a health risk assessment, which is just 25 questions you ask your client after the enrollment, which is really all about us identifying our new members and what their needs are. Like some of the questions may be, do you have any chronic conditions like diabetes or heart disease? So this way we identify those members and make sure we reach out to them for care programs. Because this is all about, when you do a health risk assessment, the company, any insurance carrier, they want to know about their new members and how they can address their needs quick. And by doing it as soon as you submit the application, there's nothing quicker than that. So when you do that after the enrollment, after 25 questions, Aetna actually will give you a value-based enrollment bonus of $70 per application for you, asking your client those 25 questions after an enrollment. And that's for new members. So we can, that's the bonus that they'll give back after you do that survey. And then if they agree, let's say they don't have time for you to do it, but they say, okay, well, Aetna can call me back, and you actually set up the date and the time, the reward drops down to 10, but if you do it, it's 70. So that's really what you want to do when you try to enroll a new member. So you can make some extra money, $70 for each of those enrollments. And then I mentioned before, this year for 2021, our New Jersey market added a new product for people that are on Medicare and Medicaid. So for those people that qualify or eligible for that, we are in 10 counties, mainly in northern New Jersey, and then we have Ocean and Camden. But for 2022, so for this annual enrollment period, we will be expanding to the entire state with this product. So you'll be able to sell it in any county of New Jersey. And it's a really solid plan and a really good network with that dual plan. So I'm really looking forward to when we expand to the entire state. And of course, with that, there's going to be a lot of more community events, because we'll be expanding into more counties. So there's going to be a lot more activity and a lot more opportunity for, new agents. And that's it. Do you guys have any questions for me?
Thank you very much, Michelle. Yeah, we can open it up to questions. You want to stop the screen share?
Yeah, let me stop share.
I'll kick off a question, Michelle.
Mhm.
So during COVID, you started to have like you can talk a little bit about what you do during AEP for the um, in-person presentations and workshops, and then how you adapted during COVID with the
Yeah.
online seminars,
Okay,
and how did
good.
that
Yeah, it's
work?
a good.
How did that work out? Mhm.
Okay, I'll talk about it. So COVID threw us for, a loop because our business with seniors are normally best in person, face to face. We have what we call advertised public meetings during AEP. Normally, I have about 50 all throughout the state. So what I do is I don't direct sales. So I bring in my brokers that I basically entrust, value, right? That I know can do a presentation in front of folks, that would follow up with everyone that's coming to that meeting. It's really an awesome opportunity because everyone that comes into that meeting will walk in, and the goal is for you to get every person's permission to contact or lead to follow up with, whether it's going to be an Aetna enrollment or any enrollment. But these are really a way to generate leads for yourself. And the best time to do it is when folks are most eligible, which is during the annual enrollment period. So I partner with my brokers. Brokers can come to me and say, I want to do, I think I want to do a meeting. I can help you prepare for that meeting because if you haven't done that, we basically do it together. Pam did a couple with me this year. We decided to do all virtual meetings this year. So it definitely changed the landscape. We did not have the same participation as we have had in the past when we just do a public meeting where people come in. I bring coffee and donuts, and we do a sales presentation. We talk about Medicare, we talk about the Aetna plans. But, we did this all virtually this year. So it was very different. Usually when we're in person, it's an open dialogue. Seniors start asking questions. We kind of start chit-chatting about everything. They come to us after. In a virtual meeting, we didn't have that same interaction. The other folks couldn't even speak. They had to ask through the chat. So it was different, and we definitely had to adjust. We had a lot of members coming out, so it wasn't as I thought as valuable as it normally would be in person. But we made it through. I mean, they went okay, and we still walked away with folks with sales and with leads. It just was not at the same volume. So we will be looking to probably do both this year for AEP because you don't know what's going to happen in the fall and if folks are going to be completely comfortable being in person. I hope so. I mean, that people are vaccinated now, of course, that people will feel more comfortable, but you just don't know. So we'll probably, and I'm being optimistic, we'll probably have both available, virtual as well as in person. So, but we all had to adjust to do business a little differently. And that's one of the new trainings we actually have. We're teaching brokers how to compete in a virtual marketplace because there's a lot of competition out there. And I think COVID even sped everything up with, trying to sell people more, either online or over the phone. So we're teaching brokers how to come up to speed and also compete with that type of capabilities because brokers can do that too. Our Ascend application has video capabilities now. You can compete just like anyone else can compete. So we're just preparing people with those tools. Sometimes it's a little harder to convince people that have been in the field for 50, 40 years with the virtual world, but you really should just have it, just be prepared for it because you never know what your client more and more seniors are adapting to virtual world. So, you'll be surprised. I know Pam could probably, co-sign that. You do a lot of your business, by Zoom, virtually,
Mhm.
and it's been working. I mean, people are
And
changing, so you want to be prepared for either or.
yeah, especially for the ones who are turning 65 and on the
Yes.
younger end. But one thing I have to say about this AEP, it was challenging with the webinar format, but I actually was able to see more people because I could cover the whole state, as opposed to like before, I would just pretty much be meeting people in Middlesex, Mercer, and Somerset County. This AEP, I had, everywhere from, northern New Jersey, Bergen, down to Atlantic
Yep.
County. I had the whole county because Michelle could bring me in on clients that were anywhere
Yep.
if they attended the webinar. Jessica, did you have a
Exactly.
question?
Yeah, so when you're expanding it because of the online presence, how does that impact future years? Will you have need to go see them later on? So you'll end up kind of seeing these people that are far away? Or do you think those would stay virtual?
Yeah, I mean, if you have, so I mean, we have agents, believe it or not, that sell New Jersey plans in like Utah, so those people will never see their clients, so if you originally enrolled them that way, I mean, I always just encourage people, um, just protect your book of business throughout the year. So when you enroll your member, just, reach out to them once in a while, touch base, ask them if everything's working okay, send them an email, send them a birthday card, when you get their birthday, like things like that, keep your members with you and letting them know that you're the person. They'll meet, if they enrolled or savvy enough to enroll with you virtually, they're going to continue if they want to make plan changes and, you're not able to drive down there. Because I mean, if I'm a broker today, I would really leverage what's going on right now, like with the whole coronavirus, because like Pam said, you used to waste a lot of time in the car, like driving here and driving there. I mean, I have a broker that refuses to do anything virtual and drives everywhere. And sometimes he drives 100. One time he drove like over 100 miles to Pennsylvania and the person wasn't even eligible. So I'm like, so you want to avoid wasting your time. And, I think that this virtual landscape, there'll be certain people that they want to see you in person. But for the most part, I think a lot of people are getting used to doing it this way. So that's why I like to make sure people are prepared, either way, because you never know what your client's going to want. I mean, some people do want to see you in person. It's just the way they are. They rather do that. I would say my dad is like that. You'd rather see someone face to face than do something on the computer, but he's also a lot older than 65. So as people are, in their comfort zone, I would just see what they're comfortable doing. But I think if you enroll them far away, I don't think it'll be a problem retaining them as long as you don't lose focus and keep in contact with them, because people are flaky, sometimes, they'll forget about you. They won't, they'll call that Joe Namath commercial and they'll be like, oh, I signed up with that guy, some guy on the phone. And they'll, so if they know you a little better and know, like, call me anything, call me for this problem. I can also switch you. I'm contracted with other plans. I can help you each and every year. We'll reevaluate everything, make sure you're in the best plan that fits your needs, so this way they know you're on their team, so they don't forget about you.
Thank you.
Yeah, that's so true.
Yep.
Yeah, I check in with people. Um, and after the fact, it's not a Zoom, it's a phone call.
Yep.
And they're very thankful. Oh, by the way, I, have this particular problem, or I don't know what I'm supposed to pay. And you just look it up for them and you provide a little extra service.
Yep.
And then they're
Yeah.
happy
It
because
goes a
they're,
long way, and they'll refer business to you because
Mhm.
they'll know, like, oh, you can help my sister. She's turning 65 next month. That it might spark something in them, like, oh yeah, I have a neighbor that needs help. So touching base once in a while can lead to more opportunities, trust me. And I don't think enough agents really take advantage of that. Pam could speak to that because I mean, so many times we have done meetings together, this virtual AEP, where these folks were working with other agents. They can't remember their name or they don't call them back. And then guess who gets the sale or gets the person now to be the agent of record? It's Pam, because she's there to answer their questions. She's there to help them. She calls them back. She does her research. And you know what? Sometimes the research is something that Aetna did wrong with service and she can't resolve it. But guess who she comes to? She'll come to me. We'll get it fixed. And guess who looks like, the hero? Pam. That's the goal. We want you guys to be the hero and you can solve the problem. You just tell me what's going on and then we'll get it situated internally. But the member doesn't even need to know that. They're going to think you're the best thing since, apple pie. They're going to be like, wow, that Pam does everything for me. And they don't forget. Then they refer their friends. So, because another agent kind of, didn't call these folks back, she was able to get 2 clients from that. So that will happen too. People that, just want you to be their agent of record. You didn't even sell them, but because their agent, either they signed up on the phone and they don't really have an agent, or they signed up online by them. Some people do that and they didn't, they made mistakes, needed some guidance. We do honor that at Aetna. We, some other carriers don't do that. You could, the member can request you as their agent of record. And then you would basically get that annual residual payment for them every single year from, until they expire, celestial expire, we call it, until they pass away. So you would get the lifetime residuals for that person, unless they make a change with another broker. That's the way you lose a client. But hopefully that wouldn't happen, so that's, it may happen here and there, but for the most part, you can avoid those as much as you can. Some people are just unavoidably, unfortunately, but.
So with, I'm sorry, I'm not familiar so much with agent of record. Do you actually have to sell them a product? It sounded kind of like you didn't have to sell them a product in order to be their agent.
So I'll give you a good example. So we did a virtual meeting, but even if you, let's say you met a person at CVS, okay? Let's say you meet someone at CVS and they're like, wow, you're here every week. I like you. Or you could be like, I can help you. Do you have a broker? You can ask them that. If they say, well, I don't know, or no, I can be your, point person. I can be your agent of record. They can write down, they want you to be their agent of record, or they call member services. With Pam's example, we did a virtual meeting together and the husband and wife basically said they were working with an agent, but he wouldn't call them back. And they were in the wrong plan. They were paying way too much money and they needed a plan change. So either way, she still became their broker of record because I think you rewrote them, right, Pam?
Yeah,
but you don't have to rewrite. You don't have to rewrite them. Let's say they, because they already were loving her anyway. And if they didn't make a change, I'm sure they would have made the steps to call service and get, switch over to her, because now, she would be the person that would be reaching out to them and helping them with their issues. And it's good to reach out to your clients right before AEP, of course, because then do you want to make a change? I can, we can look at some other plans. Are you happy with what you have? You want to make sure you touch base with those folks, because if you don't, someone else will. That's what will happen.
Absolutely.
Yeah.
Yeah, so I have a question. So with the AEP, what happens during that time? Do you have a list of people who are turning 65 then, who are then reached out to?
No, we wish. That would be ideal. We had a list. No,
So
the way.
How do you get to arrange your meetings?
Well, the whole thing is when you're new, you want to, you reach out to your centers of influence. I always tell folks, you can also be your own lead generator, right? So if you are involved in any churches, anything that will allow you to kind of put a table up and answer questions about Medicare, you really want to try to generate your own leads. People, referrals, telling people you do Medicare now. We have social media marketing that you can put on your social media page.
Yeah.
You can
That's
do
another question I
flyer.
had.
Yeah, you can
Are there
do
any
flyers.
restrictions?
Right. Yeah. So these are all things you can try on your own to generate your own leads. But of course, there's other ways, during AEP, things come in, we have a lead program, but as things come in, so these are things that we can talk about opportunities. We don't get them all year long, but during AEP, that's when people call the phone unit and say, I want a local rep to come and, come either to my home or call me. And we get those as well. So things like that, or opportunities we can give out to the field. But yeah, you have to get up and running first, of course, ready to sell. But yeah, those are opportunities. And I would just definitely recommend trying to do something in the field, like either, once a week at a CVS, or if you want to do more, you can, or, 2 or 3 hours out of your day. It doesn't have to be Monday through Friday. It could be Saturday or Sunday. I have brokers consistently wanting to do CVSs, and there'll be other events, because like I said, we're expanding into other counties for our dual plan. And you can use those opportunities to meet more people. So that's really the name of the game. And then from there, you want to always ask for referrals when you're, talking to anyone, letting your friends, family, everyone know you do Medicare now, if they know of anyone to refer over to you. And basically, you always want to ask for referrals, even when you finish with a client, if you know anyone that's on Medicare, send them my way, give them a flyer, give them your card, whatever it is. But yeah, those are all ways, and we'll help you with that. Like once you become certified, we'll show you how to make your own customized flyers. We'll show you where the Facebook or the LinkedIn material is. You can put on those pages if you use Facebook. So there's all types of ways you can advertise yourself. And I'm sure Pam has ways that, you guys can generate more leads as well as a team.
Okay.
Yeah,
So
what
are there
I'd
any
like to do
sorry,
is
go on.
to do like with each person, do like a little business plan, a little marketing
Right.
business plan,
Exactly.
because each one of you may have a different thing you're willing or can do. Like Sandra works full time basically, so she's doing it part time. So it's going to be customized to your schedule,
Right.
where you live, where if you're willing to be out there. And it is
Right.
important to get out in the community or to start networking with certain groups, whether it's senior centers or housing. And it's really not as hard as you think. And people will take the call for certain, like the senior centers and senior groups, and you may not get everyone, but if you want to set up an event, then Michele can also help set up, the events.
Yeah.
So Michele, is it
Library
okay
to do. Yeah.
to set
Go
those
ahead.
events up and have other plans there as well? Is that something that you're okay with?
Well, if it's an Aetna event that we partner together, like the whole table is going to look like purple Aetna. It's going to be branded with our signs and everything. I mean, you should talk about Aetna Medicare, but obviously the first thing you should be saying is, I'm an independent agent. I'm here today representing Aetna. However, I do sell all the plan. I can offer you all the plans,
Okay.
and we can evaluate what your specific needs are, and I can make a recommendation based on that. But
Okay.
I wouldn't put like a United Healthcare sign on an Aetna
As well.
table, or vice versa. So if you're there doing an event for United, I mean, I'm nice. I would never be like, but United might be
It's
mad
just
that
not
you
nice.
have an Aetna
Yeah.
sign on your table. I mean, we're not just supposed to do it. It's like a conflict. Now,
Okay.
if you were there, let's say you did an event and it was for your agency, that's different. You can do for your agency, and if it wasn't like the Aetna, you can even have an Aetna sign, but it wasn't like, we didn't set it up, we didn't give the opportunity, you did this on your own. Your church said that you can be in the lobby after service, marketing your Medicare business. You can do that all day, and you can do whatever, you can put whatever you want out. But if it's like an Aetna event or even a United event, then they're not going to want the other carrier's info. But the goal is to get your permission to contact. You let them know you're independent. You can do a complete analysis and recommend a plan that's best suited for them. But you let them know initially, like you offer all the plans.
Okay.
Because if you don't let them know that, then like I had a broker that I did a virtual meeting with, and he didn't make that clear. They thought he was an Aetna employee. So the person ended up signing up for another carrier. And then when he followed up, he said, well, I didn't know that. You didn't tell me that. So I always tell my brokers, lead with that so they know that you are independent. You're contracted with Aetna. You can answer any Aetna questions, but I can also help you with any other carrier as well. And I'm contracted with blah, blah, blah. And that's it.
Okay. Thank you.
Yep.
And that's very helpful. Well, great. Thank you so
Hey.
much. I know we're coming to 1 o'clock and I wanted to keep this, you know, a lunchtime thing. So thank you so much. If anybody has any additional questions.
Maybe when one day we get in person, we can do the
Yes.
real lunch and learn.
Exactly.
I love to eat. I love to eat.
Yes.
Yeah, and pre-COVID, we typically Aetna would treat us to lunch at a Seasons 52 or right.
Yeah,
You know,
good
so
places. Yeah.
Aetna's good.
We can do
for feeding
something
us.
outside. Like once you guys get a little closer to everything, certifications, everything, we could do like an outside lunch because that would be, you know, the weather's breaking.
Yeah.
That sounds
Exactly.
good. Yeah.
Great.
All right.
Well, thank you so much,
All
Michele.
right, guys. Thank
appreciate
you.
it.
Thank you.
All right.
Thank you.
Take care. Have a good weekend.
All right. Bye,
Good.
All
everybody.
right. Bye-bye.
Bye.